Hey everybody, it is Nurse Eunice with Florida Training Academy, and I have missed you all so much. I see a few of you all in the chat, so hello, welcome, and I look forward to helping you pass your CNA examination. So, as we do in each of the videos, I will give you about 10 seconds to receive your notifications, and we will get started shortly. All right, let's get ready to have fun, everybody. Tonight's video is about long-term care. So we'll talk to you about the differences between long-term and acute care and how this test is going to help you pass your CNA examination. So hi again. All right, and so this is very near and dear to me. You all, next week is National CNA Week. That's right, you get your own week. So if you are somebody who knows a CNA and you want to nominate them, you will send an email with their name, the reason why you think they make a great CNA, and a photo, which is optional, to admin@fltraining.com. And I'll make sure I put that in the chat. Again, that is admin@fltraining.com. And so, what will they receive? First of all, they're going to receive a shout out on all of our social media channels, including our YouTube channel, which has almost 1 million subscribers. They're going to receive a digital certificate of excellence. They're going to receive a badge from Nurse Eunice, from me, that they can put on their resume, etc. So, we want to help you honor those who help you so much. And so, if you know a CNA who is deserving, who's worthy, who goes above and beyond, please send that nomination in to us. All right, so hi, Monka. Hi, Benita. If you haven't already done so, you can download our free study guides. You can either go to nurseeunice.com, which is shown on the screen, or you can go to fltraining.com/links, which is in the description area. All right, and so let's help you with your long-term care. In case you have questions, whenever you take your CNA test, a lot of those questions are not based on hospital level CNA work. It's based on long-term care, as if you have a resident. And so this test is to help you prepare for those types of questions. And so let's give you a welcome. Welcome, future CNAs and caregivers. In today's video, we'll break down the key differences between long-term care, home health care, and acute care settings like hospitals. I see so many familiar names. I love it. And so each setting offers unique experiences and responsibilities for CNAs. Home health care means one on one care in a patient's home, often involving flexibility and independence. 4-hour shifts, or you can just do a 1 hour stay with the patient, and you'll have maybe 8 patients in a day to total an 8-hour shift. Versus hospital or acute care, that's fast paced. In a hospital, they don't necessarily call you a CNA. Your title will be patient care tech, patient care associate, but the care is focused on short term. Person comes in, they have a medical concern. We're going to try to get them back to their normal state of health as quickly as possible, and then get them home. And so when you think of acute care, think of short term critical care with a variety of patients, anybody from a laboring mother to a pediatric patient who may have had a sports injury, all the way to the end of life, someone who's on hospice. Now, long-term care would be like nursing homes or assisted living facilities. They center on building relationships and providing consistently daily support to your residents. And so with long-term care, sometimes they will offer 8-hour shifts. So if you want to only work a few hours a day, you can do home care. If you're okay with working 8-hour shifts, think long-term care like nursing homes and assisted living facilities. But when you're ready for the fast-paced lifestyle, that is when you would take your CNA license, go apply at a hospital for a patient care tech position. So each of those levels has a different scope of practice. And so, but your overall goal as a CNA is to keep that patient safe, and of course, to notify that nurse if something goes wrong. All right, so let's see what you all have in the chat. I'm so proud of you. Congratulations. I think it's Maker Link. Congratulations. Very proud of you. All right, so long-term care, we're going to continue on learning about the unique needs of long-term care residents is essential for passing your CNA examination and providing compassionate and consistent care. These residents rely on CNAs for daily support, dignity, and safety. Understanding their needs will make you a stronger caregiver and a better test taker. If you haven't already done so, go ahead and get those pens, some scratch paper, be in a quiet area, and let's get ready to take our practice test. All right, team. All right, question number one. A resident who is unconscious is at risk for, is it bed sores, diarrhea, anemia, or falls? I'll give you about 5 seconds to put the correct answer in the chat. All right, we're going to be revealing that answer in 5, 4, 3, 2, and Anastasia and Nail and Sandra, Vivian, Messi, Miss Bonita, you all have it correct. Everybody chose A. That is right. Immobile and unconscious residents are at a higher risk for skin breakdown due to pressure, which could lead to pressure sores. Question two. Which of the following is a sign of hypoglycemia? Would it be A, fruity breath odor, B, slow heart rate, C, cold, clammy skin, or D, increased urination? And I'll give you a few moments to answer this question also. And thank you all for joining me on a Wednesday Night Live. I appreciate you all. I love studying with you. All right, here we go, team. If you chose, this one's a little bit tricky. It is going to be C. So I see A's and I see D's. So whenever you think of the fruity breath odor, that is for somebody who has uncontrolled diabetes. That means their blood sugar levels are high. And whenever someone has polyuria or increased urination, that's usually a sign of high blood sugar, hyperglycemia. So if you chose C, you understand that cold, clammy skin is what we call diaphoresis. And so that would be usually caused due to low blood sugars or hypoglycemia. All right, so question number three. Which resident should the CNA assist first during your morning rounds? Would it be a resident requesting a shower, a resident who needs help finding their dentures, a resident asking for water, or a resident who needs help to the bathroom? Who would be your priority? And you can't say all of them because you're only one person. You can't do everything at one time. All right, revealing the correct response in 5, 4, 3, 2, and couldn't trick a one of you. You knew the answer was D because a resident who needs to use the restroom is at a higher risk of falls and also of incontinence, meaning that they can urinate or defecate on themselves. And so that's the patient that you want to make a priority. Question 4. What is the correct method to measure urinary output in a graduated container? Would it be A, estimate the amount visually, B, hold the container up so it can be read at eye level, C, tilt the container to see the numbers, or D, read at eye level on a flat surface? So you just empty the drainage bag. You need to empty the contents from that drainage bag. How do you read what's inside of it? All right, we see some correct responses coming through. So we're revealing the correct response in 5, 4, 3, 2, and for question number 4. If you chose D, you have it, especially when you're taking your CNA test. Not only do you have to read your graduated container at eye level, you have to put a napkin beneath the container. So you're going to take the container into the bathroom, put your napkin down first, your container on top of it, you bend down, you make eye contact, look at those numbers. When the fluid is no longer moving, that would be the correct reading. Also give your nurse time to see, because usually, especially for the state of Florida, your reading can only be 50 cc's away from your nurse. So make sure your nurse sees your reading before you pour the simulated urine into the toilet. So great job, team. Question number 5. A resident begins to fall while you're walking with them. You should A, try to carry them to safety, B, hold them up firmly, C, ease them to the floor safely, or D, let go to avoid hurting yourself. Your patient begins to fall. What's the best response? That is right, Toyin and Vanette and Sophie. You all, we're doing an assist. That is not a fall. You have that gait belt. You're going to slide them to the floor while you're screaming for help. Do not try to hold them upright. And when you have them on the floor, Go ahead and lay them on the floor. Don't want to have them still upright, sitting down on the floor, because if they have low blood pressure, they're still dizzy. There's not enough blood flow going to their brain. So go ahead and lay them down. And if you can, raise their feet, maybe put their feet up on a chair. And those nurses, everybody's going to be coming, running to you. We will help get that patient back into the bed safely. So your first step is to get them to the floor. Question 6. What is an example of a CNA violating a resident's privacy? Would it be A, sharing a resident's diagnosis with a roommate, B, closing the door before assisting with toileting, C, pulling a curtain before dressing a resident, or D, knocking before entering the resident's room? Oh, this one is so easy. I'm only giving you 3 seconds on this one. This was super easy. That's right, Tanaka and Manka and Mickerlin. We can't fool you all. It was C. I hope you're as proud of yourself as I am proud of you. Question 7. When communicating with a resident with hearing loss, you should A, speak slowly, B, shout loudly, C, speak clearly and face them, or D, use exaggerated lip movements. I'm happy y'all couldn't see me do that. So, team, what do you think the correct response is? That's right, Miss Sharon and Adeline and Josephine. It is C. So it's really hard, especially when times when we have on full PPE and we have to wear our mask. I want you to, be mindful though. If somebody has an impairment, it's going to be hard for them to read your lips if they have a hearing impairment. Sometimes the way they supplement or they overcome their hearing impairment is by reading lips. So if you do have on a mask, you may have to speak a little bit louder, but at no point should you be screaming. So facing a resident and speaking clearly helps them read lips and to understand. Question 8. A CNA should report which of the following to the nurse immediately: mild swelling in the feet, or a resident who refuses breakfast. C would be a heart rate of 98, or D would be a resident with a temperature of 101. So you're probably going to tell the nurse about all of these, but which would you tell the nurse about immediately? All right, I see a lot of correct responses coming through. All right, revealing the answer in. We're torn between C's and D's. And now I see an A coming through. All right, so let's talk about A. Mild swelling in the feet is not something you have to tell the nurse about immediately. What you can do as a CNA is you can elevate the feet while you're in the room. And when you see the nurse in the hall, you can let her know. A resident who refuses breakfast, the same exact thing. You can let the nurse know when you see her in the hall. A heart rate of 98 is not necessarily what you're going to let the nurse know about immediately, because you have to know your normal ranges. And so for an adult, a normal heart rate is 60 up to 100 beats per minute. So if the resident's heart rate is 98, is that the resident's normal range, or has it increased significantly? If it has not increased significantly, that is not anything you're going to tell the nurse about immediately. However, that temperature of 101 degrees Fahrenheit indicates that your patient has a fever. So make sure, because we usually have you recheck vital signs twice if they're abnormal. Take off some of those extra blankets. Maybe the room is really hot because, our elderly patients, they're cold natured, and so they like to keep the room hot. See how you can adjust the temperature of the room. Maybe pull back a blanket, give it 15 minutes, recheck the temperature. But if that temperature is still elevated, signs of an infection, go let your nurse be made aware. And after you notify your nurse, that is when you would document. Hey, Abiola. All right, so question number 9. A resident often carries a doll and treats it like her baby. One day she is wondering and crying that she can't find her doll, or her baby. What should the nurse aide do? A, ask the resident where she last had the doll. B, comfort the resident and help her look for her baby. C, ask the activity department if they have any other dolls. Or D, let the other staff know that she is confused and should be watched closely. I saw some more good news. Congratulations, Ellen. Hey, ma'am. Thank you so much for your effort. You helped me pass my test after failing 2 times. May God bless you. I am so proud of you. Keep up the good work. And whenever you are in a position to teach, keep teaching, because eventually something's going to sink in, and maybe you could be the person who helps somebody else pass their exam. And so we're always going to pay it forward. So thank you for letting me be made aware, and I appreciate you. All right, so question number 9, everybody. The correct answer is B. Supporting the resident's emotional needs and helping her look for her doll validates her feelings and her feelings and maintains trust. So let's go back, because I see some people who chose C. The reason why it's not C is because maybe her doll was brown skin and the activity departments may not have any other brown skin dolls, or maybe her doll had on a particular dress. So if you just go to the activities department and try to trick her to get another doll, she's going to be like, hey, you took my baby. So it's just best to help her look for the actual baby. I know that she has some type of confusion, maybe dementia, but it's best to help her look for her actual doll, because I'm sure there's something about it that she will remember and she'll recall. All right, question number 10. A nurse is asked to change a urinary drainage bag, but has never done it before. What should the nurse aide do? A, change the indwelling catheter at the same time. B, ask another nurse aide to change the bag. C, change the bag and ask for help if needed. D, ask the nurse to watch while changing the bag since it is the first time. And I expect for a lot of you to get this answer correct. And you did not disappoint, Edward. I see you, and Anastasia and Allie and Veronica and Josephine. Yes, it is D. Look, you all. Whenever you get hired on a job, they're usually going to give you a checklist, and that checklist may have 3 pages of skills that you should be watched while performing. And if you don't know how to perform something, you're going to tell them, hey, I don't know how to do this, so that the nurse can, number one, teach you, show you how to do it. So we'll usually show you once, we'll watch you as you do it, and then hopefully by that third time you're competent, you can be signed off on it. So safety and supervision are key. It's appropriate to seek guidance when performing a task for the first time. That prevents injury to the patient. Okay, remember, patient safety. Go ahead and ask for help. Question 11. Which of the following is considered a restraint? Would it be A, side rails left down, B, a seatbelt used in a wheelchair for safety, C, tucking in sheets so tightly a resident cannot move, or D, having the call light within reach? Which would be considered a restraint? Yes, 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 yes. So when I started nursing way back in the day, we would like literally take an additional sheet and wrap it around our patient's legs and tuck it tightly under the bed. Yeah, that was a restraint, and that was illegal, but that was back in the day. That was 20 some odd years ago. So now we know better. We do better and we know better. So you all cannot tuck those sheets so tightly that the resident cannot move. That would be a form of restraint. So the correct response is C. Any method that restricts voluntary movement, such as overly tight sheets, can be considered a restraint. And so what do we do now? We would actually get an order for a sitter, or we would have a bed alarm so that if the patient tries to get out of bed, they'll be alerted. The patient should be able to move. We just don't want them to get out of bed without assistance. Question 12. Which is a job task that a CNA is allowed to perform? Is it A, participate in care planning conferences, B, take telephone orders from doctors or physicians, C, administer medications, or D, change sterile dressings? And we have another testimony. Hey, Louise. So today is 1 week I took my CNA exam, and guess what? I passed. Thank you so much. I am so proud of you. Congratulations. And thank you for coming back and letting us be and telling us so we can celebrate you. So you all, we've had about 5 people who've come on and say they passed their CNA exam. So if you're worried about passing your exam, don't be worried. Just practice. Find a study buddy. Read our questions. We have so many questions. So there's no reason for you to fail. My job is to help you get into healthcare, to be confident, to be competent, because I need you all. We need you all. Our patients need you. So we're going to make your lives easier and help you study for your test. Everybody, question 12 is tricky. Let's see. I have A's, I have B's, and it looks like I have a D. So the correct response is Hey, so you all, that's nothing more than a meeting. And the CNA spends the most time with the patient. So if a patient has a resident care planning conference, aka a meeting, you're going to be there. So CNAs may contribute observations such as she's not eating that well, she refuses to use her dentures during a care planning conference, but cannot perform clinical tasks reserved for licensed staff. So what you cannot do is with a regular CNA license. Now, in some states, once you have a year of experience and you take an additional class, you can administer medications, but that's not for your test. For your CNA test, you cannot take a telephone order from a doctor. So if they are, I don't care how fast they're calling out these orders, you have to put them on hold and let them know that you're getting the nurse to the phone. Because even if you tell me the right order, I cannot take an order from a CNA. I have to get it from the physician. So you put the doctor on hold. So you can't do B. As a CNA without that advanced training, you cannot give medications, and then you do not do sterile gloving. You put on clean gloves. When you think of sterile gloves, think of something invasive. And as a CNA, you cannot go inside of the body. So who would be able to put on sterile gloves? A patient care tech working in a hospital, because they may have to help with urinary catheterization, which requires a sterile technique because they are inserting a catheter inside of the body, inside of urethra. So I hope that helped you understand question 12. Question 13. Thank you so much, Roxana. All right, question 13. What is true about range of motion ROM exercises? A, are they only done once a day? B, are often performed during ADLs like dressing? And while I'm reading the other questions, if you know what ADL stands for, please put it in the chat. Would it be C, require 10 repetitions per move? Or D, prevent strokes and paralysis? All right, so which is true about ROM exercises? That's right. So we have the correct responses. And then Veronica put in the chat that ADL stands for activity of daily living. And for everybody who put B, you are correct. And so ROM exercises can be incorporated into daily activities to maintain joint flexibility and mobility. So when you go into a room, you're not doing a nursing assessment, but as a CNA, you still get to look, you get to assess. So if you see me scratching my face, maybe touching my head, that more than likely means I can at least comb one side of my head or brush it. And if during the bath you needed assistance, you would give me the washcloth so that I can wash my face. My rule of thumb is unless they're confused, they have dementia, if they can touch it, they can wash it. If they can reach it, they can wash it. And so I need you to be thinking about that. Even if a patient has had a stroke, the side that they can move, you want to encourage them to move it, especially during bathing and just basic skills. So if they need help feeding themselves, maybe they can actually feed themselves the toast, but you manage the food that's on the actual spoon. But please ask your patients to help in their care so that they won't become so dependent on us. Question 14. What is a sign of dehydration in long-term care residents? Is it clear speech, good skin turgor, moist lips, or strong urine odor? A sign of dehydration. A sign that you may want to consider asking that patient to drink some water. And that's my hint. So everybody revealing the correct response in 3, 2, and yes, it would be D, strong urine odor. So dark, strong smelling urine, dry mouth, and low fluid intake are all signs of dehydration. Encourage more fluids. And if they don't want fluids, don't forget some of your facilities have popsicles. So give them what they want so that they can get some fluids if they don't want to drink the water. Question 15. When making an occupied bed, you should A, roll the resident to one side, B, make the bed while the resident is asleep, C, place dirty linens on the floor, or D, ask the resident to get out of the bed. I want you to think about D. If the resident could get out of the bed, you would not be making an occupied bed. You would have them in the freaking chair. So we know it's not D. So what is the next best response? Yes, everybody, it is So whenever you are assisting someone, whenever you're making a bed with them in it, you want to turn the resident safely to one side while changing the linens on the opposite side. And we have full videos on our YouTube channel. We have videos whenever you go to the playlist. We have a full clinical skills library. So it's no reason for you to fail your written or your clinical tests because Florida Training Academy and Nurse Eunice has you covered. All right, question 16. A confused patient tries to grab a hairbrush while being dressed. What should you do? Should you put the hairbrush away? Should you let the resident hold the hairbrush? Should you dress the resident faster? Or should you restrain the resident's hands? They're trying to grab the hairbrush. You're trying to dress them, and they're over here in La La Land trying to grab a hairbrush. What do you do? We are torn between A's and B's. I love it. Now, I want you to just for a moment disregard the fact that this is a resident in a facility. What if it was a toddler and the toddler just kept reaching for something and it was distracting them? Would you take it out of their hand or would you let them hold it and then you dress the other hand while they're distracted? So the best response is going to be B, letting the resident hold the brush. They weren't hitting you with the brush. They were just trying to hold the brush. Let the resident hold the brush gives comfort and reduces resistance during care. I do want to go back because maybe some of you all wanted to remove the hairbrush because you thought the patient was going to hit you with it because the resident was confused. Remember to, whenever you're reading your questions for your test, to don't add anything. Just because a resident is confused, it does not mean they're combative. You have a lot of patients who are pleasantly confused. They're like, la, 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 la. Just leave me alone. Let me hold my hairbrush. Let me hold my doll. I'm going to be okay. That doesn't mean they're going to hit you. So confused versus combative, two different things. See if there are any new comments. All right, so question 17. A resident who is alert and oriented is found on the floor. The CNA should A, help them up and say nothing. B, report the incident and complete a fall report. C, stay with them until the nurse arrives. Or D, move them to their bed without asking questions. All right, looks like we're torn between C's and B's. It's like half and half. And looks like the C's have it. So what I do want to say is, Danica, you were fast. Like no sooner as I got the last option out, you were putting C in there. So great job, girl. All right, so everybody, question 17. What you want to do first is stay with them until the nurse arrives. Okay, that's the priority. What are you going to do? Go document and leave your resident on the floor? So the rationale. So the answer is C. Even if a patient appears alert and uninjured, a fall must be treated seriously. The CNA should stay with the resident, offer reassurance, and notify the nurse immediately so a proper assessment can be done before the resident is moved. CNAs are not allowed to assess injuries as far as, oh yeah, are you measuring wounds? Are you doing any of that? No, you can pretty much do a pain scale or a pain assessment so you can let the nurse know. So since you can't do those nursing assessments, you should not be moving that resident before the nurse comes in and checks them. And then once the situation is handled safely, that is when a fall report can be completed. Remember, think safety first, then report, then document, because in your documentation, you have to document the nurse that you reported everything to. So safety, report it to the nurse, and then document after the fact. All right, question 18, team. When providing foot care to a resident, it's important to A, remove calluses and corns, B, check the feet for skin breakdown, C, keep the water cool to prevent burns, and then D, apply lotion between the toes. And Anastasia, how are you going to tell the nurse? That is a good question. So let's talk about that. If you're in the hospital, there's usually a panic button that you can press above the patient's bed, and that's going to alert the whole floor that it's an emergency. You can also scream out help. If you're in the nursing home, they also have some type of devices where you can call for the nurse. If you're in home care, sometimes you're going to call 911 first, but your home care agency will like teach you the steps, their policies. You'll we'll call 911 first to get them there because they may get there before the nurse does. We're not going to leave a patient on the floor for an hour until the home care nurse can arrive. And so 911 will come and assess the patient, and then second, you will be calling the nurse. So I hope that makes sense. Hospital, nursing home, press the button. Home health, call 911 if your facility tells you to do that first, and then call your nurse second. All right, so for question 18, everybody, it is B. So CNA should never remove corns or calluses. You're not a podiatrist or a foot doctor. Checking for cuts or skin issues is crucial, especially in diabetic residents. Lotion should not be applied between the toes due to infection risk. So great job if you knew that 18 was B. All right, question 19. If a resident has a do not resuscitate or a DNR order and stops breathing, what do you do as a CNA? Is it A, begin CPR, B, call 911, C, try to wake the resident up, or D, notify the nurse immediately? And that's very scary if you've not, encountered that happening before. So your patient has a DNR order, they stop breathing. What do you do as a CNA? And everybody got it right. That is correct. You're going to do D. You got to call that nurse in there. So DNR orders must be honored. Usually if you're in home care, they're on a refrigerator. If you're in a facility, they're in the chart, and your patient may have a bracelet that says DNR. Some facilities don't do that. But whenever you get your report each day, you should know your patient's code status. That's one of those questions you're going to be asking. And if it's a DNR, you know that if they stop breathing or if their heart stops, you are notifying the nurse. You're not performing CPR or doing any life-sustaining acts. All right, question 20. Frequent coughing while eating may be a sign the resident is A, having difficulty swallowing, B, getting full, C, needs to drink more fluids, or D, is choking. The person begins to cough while they are eating. All right, I'll give you about 8 more seconds for this one. All right, revealing the correct response in 5, 4, 3, 2, and if they are coughing while eating, that is a sign that they are aspirating. It doesn't mean that they're choking. Remember, when someone's choking, there is no sound, there is no coughing. That is when you would do the abdominal thrust, previously referred to as the Heimlich maneuver. But when someone is coughing, you encourage them to cough. A way to prevent aspiration is to make sure your patients are sitting up in the bed. Make sure they're sitting up before you feed them. If they can't sit up because they don't have core strength, put some pillows behind them because that will help them be in the proper position to help decrease the chances of aspiration. All right, question 21. When a person is admitted to a nursing home, the CNA should expect the resident to A, have problems with incontinence, B, require a lot of help with personal care, C, experience a sense of loss related to the life change, or D, adjust quickly if admitted from a hospital. What do you think, team? All right, we have B's and we have C's. So, but we have way more C's than B's. So I am proud of all of you. And the correct response for this one is going to be C. Even though they may appear independent, residents often feel grief, anxiety, or loss when moving into a long-term care facility. They may have to stop driving. Now they have to wake up when when you're out there making noise in the morning, you're laughing and giggling, you're going to wake them up. They can't watch what they want to watch on TV because they don't have all the stations they have at home. So there is a real loss, a sense of grief. And so they may not need help with personal care. but you can pretty much guarantee if they're now institutionalized, if they're in your facility, that they are going to be having some issues adjusting. And that's where you come in at. You befriend them, you try to make them feel warm and welcome, and you try to make that facility feel as close to home as possible, because this may be their home until, unfortunately, until they pass on, until they die. Question 22. How often should incontinent residents be checked for soiling? Would it be every 8 hours or as needed, every 2 hours or as needed, every 30 minutes or as needed, or every shift? All right, so your patient, they don't want to wear a diaper. We don't call them diapers. We call them briefs, but I'm old and I still call them diapers. My apologies. So they don't want to wear their incontinent brief. And so they may sometimes leak urine. You have 20 patients. How often are you checking your resident for incontinence? And if you chose B, you have it. The other response, every 8 hours is far too long, and every 30 minutes is far too often. You have a lot of patients, so we do not expect you to keep checking on an incontinent patient every 30 minutes. But what you would do is every time you go into that room, maybe offer them to use the bedpan, or to see if they want to get up and actually get onto the toilet or the bedside commode. Sitting upright is going to help more of the urine be expelled, and that would help decrease their chances of being incontinent. Question 23. A resident whose spouse recently died stays in their room and eats very little. The CNA's best response is to A, remind the resident to be thankful for the years they shared. B, tell the resident to get out of the room at least once a day. C, understand the resident is grieving and give them chances to talk. Or D, avoid mentioning the spouse during care. That is right. Everyone has it correct. It is C. So grief is natural. So CNA should offer emotional support and encourage the resident to talk about their feelings when they're ready. And don't forget, when we're talking about communication with your residents, it's usually more about you listening and less about you talking. So you want to give them the opportunity to talk and let them know that you're there to listen. All right, question 24. Oh, a resident is sexually inappropriate. What should the CNA do? A, set firm, respectful boundaries and report it. B, walk away silently. C, yell at the resident. Or D, tell other staff to avoid the resident. And this is an easy one, so I know you're going to select the right answer. It's easy as far as the test questions involved, but it may be harder for some of you all to set those firm boundaries, but you will have to. You will learn. No one should be touching you inappropriately. No staff person, no patient. So if you are afraid to stand up for yourself, go find a nurse, go find a senior CNA to help you, to teach you the ropes, because we want to make sure that you're not abused in these facilities. So everybody, the answer is A. So you're going to maintain professionalism and dignity while reporting the inappropriate behavior to the nurse, but you're also going to tell the patient, that was inappropriate. Do not touch me there again. And then go let your nurse know. Question 25. Which question is most likely to encourage a resident to talk? Would it be A, are you feeling tired today? B, do you want to wear this outfit? C, what are your favorite foods? Or D, is this water warm enough? And I love you all. Thank you all for studying with me on a Wednesday night. Yes, you have it. So if you chose C, you understand that an open-ended question like what or how encourages conversation and engagement. So you don't want to usually ask questions that can be answered yes or no. Those are called closed-ended questions. And a scenario I'd like to give you is, let's say you have a teenage child who's upset with you and they don't want to talk. And you're like, oh my God, I can't take the silence anymore. Do you want something to eat? Yeah. Conversation's over. So instead, we need to sit down and have dinner together. Would you tell me what you like to eat so that we can have a discussion during the meal? And so now they can't say yes or no. They have to say, oh, I want some chicken, I want pizza, etc. So open-ended questions encourage conversations. Closed-ended questions do not. Thank you all for the hearts. I appreciate you all. Oh, I didn't even ask. If you haven't done so, subscribe to the channel, like the video, and we are so close to having 1 million subscribers. I think we are like 34,000 away. So thank you all. Thank you, thank you, thank you. All right, so question 26. A CNA documents that a resident ate 100% of their meal, but the tray is untouched. This is an example of A, a harmless mistake, B, false documentation, C, miscommunication, or D, an honest error. Yes, it is B. That's false documentation. So don't lie. If the patient didn't eat the food, why didn't they eat the food? Did you not bring the tray into the room? So, you want to go ahead and own up to things because otherwise, if the nurse finds out, they're going to write you up anyway. So documenting untrue information is a serious offense and could be considered abuse or neglect. So sometimes mistakes happen. I just rather you tell me and we try to, find a workaround. Question 27. What is an appropriate way to promote independence during dressing? Is it A, dress the resident without asking? B, wait for the physical therapist to help dress the resident? C, choose clothes for the resident? Or D, allow the resident to do as much as possible? Remember the key words were promote independence. And that is right. And you're right. And you're right. And you're correct. I see you, Dozy and Rose and Vanette and Messy. Yes, it is D. So encouraging self-help maintains dignity and muscle coordination. Remember, we need them to be as independent as possible for as long as possible. So we get them to help with their activities. Question 28. Before feeding a resident, the CNA should always A, take their temperature, B, offer them a drink, C, confirm their identity and sitting position, or D, ask if they want dessert. And for this one, I just don't want the correct answer. I want you to tell me the reason that that is so important. And so I see a lot of correct answers. I see so many of them. But why is it C? Why, when you're feeding someone, do you even care about their identity? Isn't a tray a tray? Like, why can't I just give Julio's tray to Mary? Why do you care about verifying their identity? And Elizabeth has it. Elizabeth said, duh, Nurse Eunice, because of the diet. That's right. Because we need to make sure they have the appropriate diet for their conditions, for their disorder. So when you verify the identity, usually whenever the trays are delivered, the trays would also have the patient's name or some type of indicator that this tray goes to that patient so that we don't make those mistakes and give a diabetic patient a regular tray. Okay, so question 28, the answer was C. Question 29, a resident with Parkinson's disease may need help with which of the following? Walking and fine motor task, blood pressure checks, understanding speech, swallowing air. I was probably sleepy when I put D there. Forgive me. So what concern does your patients who have Parkinson's, what concerns do you normally have? That's right, Anastasia and Veronica and Neil. Let's see, in Yuritsa and May, you have it. So when someone has Parkinson's disease, they usually have like tremors, those fine motor skills. So it's gonna be hard for them to pick up something small. They have stiffness and they kind of walk like a mummy. They have a shuffling walk. So those would be the considerations or the concerns when you're caring for somebody with Parkinson's disease. Sometimes patients will have Parkinson's disease and dementia. But what I don't want you doing is automatically treating a Parkinson's patient or a patient with Parkinson's as if they are demented, because they are usually still within, they're still coherent. It's just that we're rapidly firing questions off to them, and it can take them a while to actually say what they need to say. So when you're dealing with your patient with Parkinson's disease, ask simple questions, give them time to respond before you ask the second question. All right, so great job. Question 30. When providing perineal care to a female resident, always A, wipe back to front, B, skip the rectal area, C, use one wipe for all areas, or D, wipe front to back. All right, and I know you've been watching enough of my videos till you know it's the correct way to clean somebody. That's right, Edward and Louise and Miranda and Messi, we always start cleaning from the cleanest area, which will be the vaginal area if it's a female, towards the most contaminated area, which will be the rectal area. So we're going to do D. We're going to wipe from front to back. And so wiping from front to back prevents the spread of bacteria and UTIs. And if you need to watch those videos, we have perineal care videos for both females and males on our YouTube channel in our playlist. So when you go to youtube.com/Florida training, just go down. You're going to see like playlists, click on them. We have probably 10 different playlists, but there is one down there with clinical skills. Question 31. A resident with a history of stroke needs to be shaved. What should the CNA do first? A, start shaving the strong side. B, ask if they prefer an electric razor. C, use hot water to open pores. D, tell them to hold still. All right, let's see. I don't see any correct answers yet. So we're revealing a correct response in 5, 4, 3, 2, and all right. So remember, we're trying to keep them independent. We can't really let them shave themselves unless we have an electric razor. So electric razors are safer for residents on blood thinners or with limited mobility. And so when people have a stroke, the stroke could be caused by a blockage in the brain. And if it's caused by a blockage, that patient's going to be on blood thinners pretty much for the rest of their life. And so they're going to be at an increased risk of bleeding. So anytime you have to shave a patient, I don't care what their condition is, one of the questions you want to be asking is there an electric razor? Can your family bring one in? Because that's going to be the safest option for all. Question 32. When trying to communicate with a resident who speaks another language, the CNA should A, use pictures and gestures, B, face them and speak softly, C, repeat the words often, or D, assume head nodding means understanding. That is right, everybody. It is A. And so your facilities will have a communication board. That is nothing more than a laminated sheet of paper that has a picture of a cup of water, a toilet, the Smiley scale where it goes from somebody who is really happy to someone who is crying to help you determine their pain level. And so nonverbal communication tools like pictures and gestures. For example, if it's somebody who does not speak my language, when I come in with the blood pressure cuff, I will say blood pressure cuff and then point to the arm. And I can guarantee you the next time they see me coming in rolling my equipment, because I use gestures, they will have the arm out for you because they now know what that machine is used for. And so whenever you use pictures and gestures, that's another effective technique to help reduce confusion across language barriers. Don't forget, we usually do not have our family members translate important things. So if you're in a room, family members there, you can tell them, hey, this is the blood pressure cuff. Hello, my name is Amelia. I'm the CNA. That's easy. But as far as a nurse or a doctor is concerned, we usually have to use some type of hospital approved translation service to make sure that everything that we're saying, if it's something important, like maybe like pre-op teaching, that the patient actually understands it, because the family members may not say every word verbatim. Question 33. When using a gait belt, the CNA should stand A, behind the resident, B, on the resident's strong side, C, on the resident's weak side, or D, 2 feet away from the resident. So you have a gait belt. What side do you stand on? All right, revealing the correct response in 5, 4, 3, 2, and we have a lot of C's and a B. Let's see who's right. Ding, 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 ding. It is C. So standing on the weak side, provide support where the resident needs it most. Great job. Question 34. If a resident starts choking but can cough forcefully, you should A, begin abdominal thrust, B, pat their back, C, encourage continued coughing, or D, lay them flat. This one's tricky. Let's see how many of you all get this one right. Looks like we have an A, we have a C, we have more C's. We're back to some A's. All right, everyone, the correct response in 5. Tanaka said definitely not D. Great job, Tanaka. We are torn between A's and C's, everybody. So let me just give you the correct response. Revealing the response in 5, 4, 3, 2, and y'all, if they can cough, do not perform abdominal thrust. If they can cough, you encourage them to cough. You perform abdominal thrust when they stop coughing. So if they can cough, let them try to clear the airway on their own first. And so that's why you always ask them, are you choking? All right. So if they say yes, they're choking, that is when you would do the abdominal thrust to help remove the obstruction while you're also screaming out for help. And if you can, go ahead and hit that panic device, that code button, the call button, so that the nurse can come in. Question 35. A resident has a new roommate. The CNA should A, introduce them politely, B, leave them alone to bond, C, move furniture around, or D, tell the roommate to stay quiet. None of you all would do any of those inappropriate options. That's right. You are going to introduce them to one another. So the answer is going to be A, courtesy. So courtesy and introductions helps the residents adjust and feel welcomed. Question 36. A confused resident is found licking in the staff refrigerator at 5 a.m., saying that they need to eat before work. What should the CNA do? A, help the resident back to bed. B, ask the resident about their job, and if they're hungry, C, tell them they're not allowed in the nurse's station, or D, remind them that they are retired. Mr. Jenkins is in the refrigerator at 5 a.m. He is eating your food because he's in the staff refrigerator. All right. What do you want to do with Mr. Jenkins? Everybody chose B. Look, even if Mr. Jenkins is confused, his stomach may still be growling. So you ask him about his job. He feels like he has to go to work. Mr. Jenkins, what job are you going to at 5 a.m.? Mr. Jenkins, you're retired. But Mr. Jenkins' stomach is still growling. So Mr. Jenkins, are you hungry? And so the reason why B is the best response is because it's the only one that even cares about his hunger. If you just put him back in the bed, the only thing he's going to do is get back up again because he is hungry. So redirect the resident gently by engaging in their reality, because some patients, if they're confused, if they have dementia, you're not trying to agitate them. You can tell them what's right, but they're like, oh no, I got to go to work. So, okay, Mr. Jenkins, you got to go to work. What do you want to eat this morning? Let's try to redirect him. Let's go ahead and feed him, especially if the diet allows him to eat and he's not NPO. And so that will meet their immediate needs for hunger and safety. You get them back in the room, back in the bed. And sometimes we call it sundowners when they get confused whenever the sun goes down. Well, now the sun's about to come up again. So there's hope for the next shift that he won't be as confused. All right, question 37. A resident with an indwelling catheter has no urine in a drainage bag. What should the CNA do first? A, ask the resident to try urinating. B, offer more fluids. C, check the tubing for kinks. Or D, replace the drainage bag. Let's see these new comments. And Christine, Paul, and Babata, yes, it is C. Always check for kinks or blockages first, as this is often the simplest reason for lack of urine flow. And whenever you're checking your equipment, whatever's attached to the patient, remember, we always start off at the patient. So you'll say, excuse me, Mrs. Gertrude, I need to see why there's no urine in your bag. Is it okay if I lift your gown? Because you're starting at the urethra and you're tracing that catheter and the tube all the way down. Because if she is obese, maybe the pressure from her leg could be kinking or occluding the urine stream. or sometimes your patients are Houdinis and that catheter ends up getting wrapped around their leg, is not secured anymore. But always start at your patient first and then trace your way down towards the collection bag. 38, a resident who is incontinent of urine has an increased risk of which of the following? Would it be pressure sores, urinary tract infections, dementia, or dehydration? So you have to know what incontinent means in order to answer this question correctly. So a resident who is incontinent of urine, what are they going to be at an increased risk of? Oh, we are torn again between, let's see. I see a lot of B's coming through. Now I'm seeing A's. So someone put in the chat, what is the definition of incontinence? That's going to help you answer this question. What does it mean to be incontinent of urine? I mean, we're half and half, A's and B's, A's and B's. I wish you all could see this. All right, waiting for a response. What does it mean to have urinary incontinence? Yes, Babita, and then yes, Elwood. Hold on, you all are going so fast. So they're leaking urine, so they're wet, right? And then Elwood says no control of the urine. So this person is not retaining urine; they're actually leaking it out. And so if their skin is wet, they are not at an increased risk of a UTI from wet skin. If their skin is wet, they're at an increased risk of pressure sores. So if you chose A, give yourself applause. A patient is at an increased risk for a UTI if they are retaining urine. All right, so this, you have to make sure you know your terms. So incontinence means they're wet. And if they're wet, okay, pressure sore. Great job, team. All right, so A, here's the response. Incontinence leads to skin moisture, which can break down tissue and cause pressure sores if not managed properly. Incontinence does not cause UTIs. The only way a patient can get a UTI from being incontinent if it's fecal incontinence. That means that the fecal matter entered the urethra, entered the urinary tract. But you should not be able to get a UTI from sitting in your own urine. You get a UTI from not urinating. All right, so question 39. Which of the following is considered a normal age-related change? Is it dementia, contractures, the bladder holding less urine, or wheezing? Which is normal? Asada said, facts. Love it. Oh, I love studying with you all. So, this is one of my favorite questions. And the reason why it's one of my favorite questions is because we know what the media shows. The media shows that as we age, we're going to become demented. You all, that's not true. There are 100-year-old people who are still sharp mentally. So, what happens? Visual changes, hearing changes, the skin changes, the muscles get weaker. Guess what the bladder is, everybody? The bladder is a muscle. And so if the muscle's weak, it's not going to hold as much urine. And that is why when they call you to go to the bathroom, you got to move fast. Otherwise, they're going to have an episode of incontinence. So you all, from this list, the only thing that is normal would be C. So if you chose C, give yourself applause. So with aging, the bladder's capacity decreases, causing more frequent urination. Dementia and contractures, fixated joints, are not guaranteed age-related changes. Question 40. Oh, let me hide myself for this one. All right, so which set of vital signs should be reported to the nurse immediately based on the activity? Y'all, that's a lot. Just put the answer in the chat because I can't say all that. Looks like Jocelyn must have a test. I missed it, so thank you for catching that, Babata. Yes, good luck, Jocelyn. All right. So which set of vital signs should be reported immediately? We have a resting set of vital signs. We have vital signs after eating, vital signs after walking, and vital signs while watching TV. Everybody's choosing A. I need you to tell me which vital sign is abnormal. That's right. Help me teach this class. I love it. So we're torn between A's and D's, but the answer is A. I just need to know why. Which one are you going to come tell me about? Miranda says, Eunice, the respiratory rate is 32 breaths per minute. That is an emergency. That is right, because a normal respiratory range is 12 to 20. So while this person's resting, the vital signs should not be higher. When you're resting, the vital signs should be close to normal, if not normal. So a respiratory rate of 32, that person's hyperventilating. That is who you're going to report to the nurse right away. When we say report to the nurse, you don't leave them. You're actually calling the nurse while you're in the room. So great job for understanding that particular question. And you all, I love you all so much, and I appreciate you all. I just want to remind you that you are taking the right steps for your future, because caring CNAs become caring nurses. So sometimes some of the issues we're seeing is because people just want this degree. They want to be a nurse. They don't know about bedside mannerisms. They didn't take the steps that you're taking right now. So I want you to be very proud of yourself. I am proud of you, and I hope you all have a very good evening. Don't forget, we have all these practice tests. You can go to nurseunits.com. You can go to fltraining.com. We want to help you succeed. And if you have not shared our information with a coworker or a friend, please do so. We have an online CNA course, which could be taken worldwide. It will not lead to certification, but it's going to help you pass your CNA test. So if you're in a different state outside of Florida, it's just going to supplement your education and your knowledge. And that course can be found on our website too. And then lastly, everybody, thank you for watching. You know I love you all, and I'll see you in the next video. Okay, so I'll stay around a few moments in the chat to see what questions you all have. And thank you for watching. Thank you for tuning in. Good night, everybody. Let's see, please, with the 70 questions, how many are you able to get wrong? So, Joycelyn, what I like for you to try to do is try to at least get 80% or better with each test, because most states passing is 70%. But like they have the questions in different categories. For example, if you fail the safety questions, even if they only give you 5 questions, if you miss all of the questions that are about patient safety, you are more than likely to fail your test. So just make sure you're understanding the terminology, and on each practice test that you take, try to score 80% or better. And that should help you guarantee that you're going to pass your test. All right. Nell said she got 4 wrong. Dorcas said, good night, you all. I love you. I'll hang around in the chat. All right. Bye, everybody. See you in the next video.